Be something, and you can comment on this, this may be something helpful, is that we called an elderly sitter service, and you can find those listed in the book. And also, if you, when our show is over, there's going to be a list of agencies and facilities and licensed professional counselors in the area where people can get help. Those people should be able to refer you to sitter services. We had a wonderful lady named Irene, who I still adore, who just came into the house, and she came in every day, and she made sure that my mom got her medication. She made sure that she got her baths. She made sure that her house was clean, and she just went above and beyond the call of duty. And for us, that was a viable alternative to having put her in a nursing home. What are your thoughts on that and other suggestions?
Well, I think I would definitely use the resources of the senior center. They're usually one in every community. I know Robertsdale has one, Mobile has one. I think there's one in Bala Battery. They've got lots of resources and ideas for helping the elderly. I also think that sometimes a family member who may be really struggling with their income might be a resource that could be used if the family has money that can be paid to them, maybe not quite as much as what a sitter would cost.
I know that in dealing with some of the patients that we've had, the consumers who've come into Bay Point Hospital, when we have discharged some of those consumers, they have made a decision amongst the family members to alternate times. One of the family members has said, I'll stay with her on Monday, Tuesday, and Wednesday. And then another family member said, well, I'll sit with her on Thursday, Friday. And then they'd have another family member come in and sit for the weekend. In as much as the family member will allow you to come in and help them, I think that that would be a good, viable option for some people who don't have a lot of money as well. Mm-hmm. And I think that a lot of times our senior adults would prefer being around family members than they would being in a nursing home and being in an unfamiliar place. I keep thinking how I would feel if I had to go to a place where I didn't really want to be. But I will say this about the nursing homes. When we had our family member in a nursing home, the staff were so kind and so helpful. So I don't want to downplay the importance of having nursing homes, because there's a lot of very fine people that work in the nursing homes. They took very good care of my mom when she was there for rehab.
I work in senior adult services, and I'm in most of the nursing homes in Mobile County, and I can't say enough good about all the nursing homes that I go to. A few years ago, I would have been not so willing to praise the nursing homes, but I'm in there every day and I see what happens, mm-hmm. and people are very well cared for in nursing homes nowadays.
Generally speaking, I know of a number in the city that are very good, and we want to, say thank you to them for taking such good care of our senior adults. Thank you so much for being with us tonight. I really appreciate it. This has been very informative and very helpful, I'm sure. I'd like to take just a moment to say a special word of thanks again to the Junior League of Mobile for sponsoring our show. This has been so special to us that they've been willing to do that for us, and we really appreciate it. I'd also like to thank the mental health and medical professionals that have helped us: George Hamilton, Joyce Dallas, Helena Roldan, Dr. Kenan Peniskovic, Michelle Krulowitz-Dees, and Danette Overstreet. And a special thank you to the Alta Point Health System staff, particularly Carol Mann, who stepped up and offered us great support. Thank you so much for joining us, and please make sure that you take a look at your screen at the end of our show for referral numbers and contact information. We've enjoyed being a part of your life these past few weeks. Thank you so much for joining us. We hope we've been helpful to you. Good night.